You've been diagnosed with diabetes and somehow you feel very guilty and ashamed that something that you did brought this on. Here are 3 things I'm going to show you that is going to give you the power to reverse it. I'm Dr. Chellam, founder of Holistic and Integrative Center of Novi, and welcome to Chilling with Dr. Chellam. So before I get into the topic, as always, hit the subscribe button and the thumbs up so that every time I make a video, you will be notified. So let's get on with the topic. One thing that happens when somebody gets diagnosed with type 2 diabetes, and most of my type 2 diabetics feel a little guilty. They feel a little ashamed that, this was a disease that I could have prevented because it is lifestyle induced. Now, if you are one of those who's thinking, it's all your fault, you're not doing the right things, let me tell you, feeling guilty and feeling ashamed, that energy is not going to get you moving forward. What you really want to do is, how do I empower myself to understand this disease better and reverse it so I can change the trajectory of my life and my health? So that's what I want to help you with, and there are a few things that you need to understand about the disease so that when you make those changes, you understand why you're making those changes. A lot of times you've heard that type 2 diabetes is increasing. It's because we are living a very modern life. But remember, in my earlier video on the introduction of diabetes, if you recall, I mentioned that diabetes, both type 1 and type 2, have been described centuries ago. Now, it is true, type 2 was predominantly present in people of affluence, where they had other people doing physical work, they had unlimited access to food, and of course they carried a lot of stress because they were in positions of power. Now, for most of us, we do have chronic stress. But what does chronic stress, this life of abundance of nutrition, abundance of stress, and abundance of rest, actually do to our body that creates this degree of insulin resistance? Remember, type 2 diabetics have a very high level of insulin. It is not the lack of insulin that is causing their blood sugars to go up. They have too much of insulin and too much of blood sugar. So why does that happen? What goes wrong? 2 things happen. Number 1 is the beta cells. Remember the beta cells from, again, video 1, in case you don't know, a quick synopsis of it. Beta cells are those cells that produce insulin, which is situated in the pancreas, which is the organ present right behind the stomach. So when you eat food, these cells will have to produce insulin. So what do the beta cells do in a type 2 diabetic that makes them produce so much of insulin, and what do the cells do that they resist insulin? What is actually going on? Here's what happens. In diabetics, the beta cell does not respond to glucose as effectively. In fact, it's only 40% as responsive as a normal person. In other words, you eat food, your beta cells in the pancreas get the signal from the mouth, from the gut, saying, what food is coming down, let's get out and handle the blood glucose. But that communication, when it comes, the beta cells are lazy and they don't produce insulin effectively. I'll talk to you in a minute about why they get lazy, because it's the same reason the other organ that is seen to dysfunction in diabetics also has the same problem. And what is this organ? The liver. What happens is, between your meals, your blood sugar is still maintained. It's not like your blood sugar drops every time you stop eating for a few hours. It's because the liver can produce glucose from its stored glycogen. Glycogen is the storage form of glucose in the liver and in the muscle, and the liver produces and sends it into the blood to keep the blood glucose on an even keel. But when you eat, that blood glucose or the liver glucose does not get produced. In fact, the liver shuts down the production of glucose because now it knows that food is coming from the outside inward and it doesn't need to provide the glucose. In diabetics, it continues to produce glucose even as you are eating. So you're getting a double whammy. You're getting glucose from your food, you're getting glucose from your liver, and then your beta cells, that's the triple whammy actually, the beta cells that need to produce insulin also fail to produce adequate amount of insulin. So before I get into the details of why this happens, why the beta cells in your pancreas and your liver misbehave, I want to make a disclaimer. I'm making it really simple so that when you are making changes, you understand why that's being recommended. A lot of times people are asked to do a lot of things, but they don't have an understanding. So a lot of the changes are not sustainable. So here is why you need to make the changes I'm going to tell you about towards the end of this video. You remember I said I'll give you 3 things that you can do to reverse your diabetes, and wait for it. This is why you need to do those 3 things. Why does the beta cell not function? When you eat, when the glucose goes up, why does it not produce insulin? That's number 1 defect. Number 2 defect is the liver, when you're eating, is supposed to shut off its production of glucose, but it does not. Why does that happen? It's because of the accumulation of a substance in both these cells, the liver cells or hepatocytes, and in the beta cells of the pancreas. And what is the substance? It's called fatty acids. What is fatty acid? The word fatty acids, when you think about omega-3 and omega-6. But what we're talking about in the beta cells and in the liver are fatty acids stored in the form of triglycerides. Fatty acids, the breakdown of fat. Now, you may jump to the conclusion that means, oh, if I eat fat, I'm going to become a diabetic. That is not so true. There's a whole company called Verta that does ketogenic diet to reverse type 2 diabetes, and they truly believe that's the best way to reverse type 2 diabetes. I do beg to differ, but my job is to give you the science behind how this fatty accumulation happens. So how do they find out about this? They looked at the fat cells in the beta cells, the fat accumulation, and they found that if it's filled with fat, when glucose comes into the blood, the beta cells don't produce insulin. For some reason, they are very rich with energy and they don't respond to further glucose. And how do they find about the fat in the liver? They did MRI scans to look at the adipocytes, the fat cells, as well as the fat in the liver as you change your diet. So here is what happens. The reason fat accumulates both in the pancreas as well as in the liver is because your diet is very calorie dense. It doesn't matter whether you eat a keto, vegan, or paleo. All 3 of them can cause accumulation of fat in these cells if your caloric intake is extremely high. Now that you know that it's because of fat accumulation in the pancreas, reduction in the pancreatic cell, increased fat in the liver, a disordered liver that produces glucose even as you're eating, all of these contribute to your type 2 diabetes. So what can you do? Just 3 things that you can focus on for now. Number 1 is eat nutrient-dense food. What does that mean? It means different colors from different groups of food, whether it be carbohydrates, proteins, and fat. You can make your choice. For example, a Buddha bowl is a great choice. Or you could do the Korean dish bibimbap and roasted salad. I love smoothies and soups. Put in all the colors that you can. The less you heat, the more raw you have, the better it's going to be. The only thing you need to keep in mind is you gotta chew really well. So I loved chopped salads as an option, smoothies, even if you do soups, just lightly cook them. There are a lot of other foods like you could do, as I mentioned, bowls and just make a sauce to make it very palatable. So there are different ways you could get a nutrient-dense diet. But here's the key. It doesn't matter what diet you're going to follow, whether it be a keto, paleo, vegan, plant-based. If your caloric intake is more than what you spend, the chances are you are going to accumulate fat. Remember, the extra calories have to be stored if they are not used. And the storage form of extra calories is usually glycogen and fat. That's why the more efficient your cells are at breaking down, burning glucose or glycogen and fat, the healthier you're going to be. So the more you are conscious of how much you're eating, portion control, the better you're going to be health-wise. So how do they come to that conclusion? It could be the calorie-dense diet that's driving this fat accumulation. Take a person who's had gastric bypass. Gastric bypass reverses type 2 diabetes. I thought it was because it shifted some kind of insulin signaling or the beta cell function. But literally a majority of them is because caloric intake of many of the patients who underwent gastric bypass prior to gastric bypass was over 3,500 calories, and suddenly with gastric bypass their stomach shrinks. They're barely able to eat about 200 to 600 calories a day. This decrease in caloric intake alone made them normoglycemic, in other words, made them non-diabetic within a week of gastric bypass. That is very powerful information that we get to work off. So far you're getting the process. It's a couple of things that you can do to figure out if you are getting to be a type 2 diabetic or you're concerned about type 2 diabetes because it runs in your family. Number one is to monitor your blood glucose. It's called the continuous glucose monitor. Most people can get it. Talk to your doctor about getting it and use a good RX coupon to buy the meter if your insurance will not cover it because you're not yet a diabetic, or you got one of those insurances that will only give it to you if you are on insulin. Number two is to check what is called the ALT. So that is an alanine transferase, which is a liver enzyme that goes up as fat accumulates in the liver. So if you look at your annual blood work where they do a test of your liver functions, if your ALT is creeping up slowly, then you are accumulating fat and the chances of you developing insulin resistance is a little higher. So having said that, is it only low caloric diet that will shift your diabetes? Absolutely not. There are two other things that drive the dysfunction, not only of the beta cells, but also of the insulin receptor. Remember, the cells have to accept the glucose when the insulin brings the glucose. There's a dysfunction there and the liver, and that is inflammation. I'm not going to delve deep into what inflammation is in this video, but I'm going to give you an overall view of what the inflammatory markers we look for and how they might impact the cells. Remember the words inflammation and oxidative stress. These are the two things that we look for, and I'll make a separate video to explain what those are for you. Basically, if you have a lot of inflammatory markers called high sensitive C-reactive protein or tumor necrosis factor, anything that drives inflammation, whether it be food, toxins, stress, that can also increase your insulin resistance. There's something called oxidative stress, which is when you eat certain foods. For instance, you eat raw almonds. That may be okay, but the minute you roast them, the advanced glycation end product, the kind of food that gets into your body, puts a little bit of stress on the metabolism as they break down the food. So the more cooked your food is, the more oxidative stress. The more chemical exposure, the more oxidative stress. That oxidative stress can reduce the function of the cells. So it's more complex than just food caloric reduction, but let's begin with what is simple, a low-hanging fruit. And that's why I'm going to talk to you predominantly about how to shift what you're eating in order to shift your insulin resistance. So now that you know that it's because of fat accumulation in the pancreas, reduction in the pancreatic cell, increased fat in the liver, a disordered liver that produces glucose even as you're eating, all of these contribute to your type 2 diabetes. So what can you do? Just 3 things that you can focus on for now. Number 1 is eat nutrient-dense food. What does that mean? It means different colors from different groups of food, whether it be carbohydrates, proteins, and fat. You can make your choice. For example, a Buddha bowl is a great choice, or you could do the Korean dish bibimbap and roasted salad. I love smoothies and soups. Put in all the colors that you can. The less you heat, the more raw you have, the better it's going to be. The only thing you need to keep in mind is you gotta chew really well. So I loved chopped salads as an option, smoothies. Even if you do soups, just lightly cook them. There are a lot of other foods, like, as I mentioned, bowls, and just make a sauce to make it very palatable. So there are different ways you could get a nutrient-dense diet. But here's the key. It doesn't matter what diet you're going to follow, whether it be a keto, paleo, vegan, plant-based. If your caloric intake is more than what you spend, the chances are you are going to accumulate fat. Remember, the extra calories have to be stored if they are not used. And the storage form of extra calories is usually glycogen and fat. That's why the more efficient your cells are at breaking down, burning glucose or glycogen and fat, the healthier you're going to be. So the more you are conscious of how much you're eating, portion control, the better you're going to be health-wise. So I'm going to probably sound like I'm nagging, but I want to hammer down this one point. When you are told to go on a nutrient-dense diet, you need to differentiate that between a calorie-dense and nutrient-dense. So a calorie-dense, an example, if you've been surfing Google University and trying to educate yourself about how to manage your diabetes, all over you will find a low-carb diet being promoted. Because of that, you're going to grab a piece of chicken or a piece of steak or fish or turkey and have it, saying, I'm low carb, so my sugars should actually get better. I want you to understand that is a calorie-dense diet, not a nutrient-dense diet. I just want to really drive that home. So just to give you a perspective of a nutrient-dense, calorie-dense, a nutrient-dense has all of the vibrant colors. The calorie-dense is our efficiency is increased by just grab and go, right? You're eating, like, say, Hot Pocket. I don't know why I took that example, but it has cheese, it's got meat, it may have vegetables, but it's got the bread. It looks like a quick calorie-dense meal, but you're hungry because at this point, all of this gets accumulated as fat in your pancreas and in the liver and does not allow these organs to function properly. So your response to food, your body's response to food is disordered. So that's why a nutrient-dense food is much better than a calorie-dense food. That's number one. Number two, what you can get to do is you really need to focus on your calories. Your protein intake can be 0.7 per kilogram. In a 100 kilogram individual, it's about 70 grams of protein. If you exercise, you add 30 grams more. The key is the protein is not as a big issue as the fat and carbohydrates. They are the ones that add a lot of calories to your diet, and you need to look at the ratio based on your activity. If you're sitting 8 hours at work in front of a computer, you don't need as many calories. So monitor that and eat appropriately. If you have difficulty getting to calorie restricted diet, this is what you can do. You can follow Dr. Walter Longo's fasting mimicking diet to start you off. I know the caloric intake is a little low. The first day is 1,000 calories and then it's 800 calories thereafter for the next 4 days. But it's a great way to get used to eating a restricted amount of calories in a day and to jumpstart the breakdown of those fatty acids from your beta cells and your liver, clean these organs up so that your body responds to the food appropriately. So these are some of the tools that you can get to use. And the third one, the last thing that you get to do to reverse your diabetes is to get rid of the fat and the muscle. In fact, fat accumulation in the muscle is the number one step towards developing insulin resistance. So how do you get rid of fat in the muscle? Simply work out. strength training, elastic bands. Start very simple, start very slow, but the key thing is consistency. Do it every day, even if it be for 5 minutes. You will find over a period of time you are able to increase your effort for exercise and the duration of exercise. So you can see the 3 things, just to summarize. Number 1, nutrient dense. Number 2, within a certain calories for your activity. And number 3 is muscle strengthening or training. You do these 3 things, it is almost impossible for you not to reverse type 2 diabetes. Remember, as I've always said, health is intuitive. It's your business. Disease is what we go to medical school for. And that's the business of medicine. And you get to choose. I'm Dr. Chellam, founder of Holistic and Integrative Center of Novi, the best place for you to find your best doctor, and that will always be you. Remember, I said I'll get you a cheat sheet at the end of this video. To get the cheat sheet to understand what is the blood testing that you need to get, delve deeper into why you have diabetes, in the comments below, give me your email and put the words cheat sheet.